expand a little bit into some of the larger issues that definitely need our attention and that need some clarification and need some explanation from the people who are charged with protecting our children's health. It's timely that we're doing this today because one of the largest cohort studies of over 1 million children was just released today and published in the Journal of the American Medical Association. And the finding was that of all the confirmed COVID cases among children, the hospitalization rate, according to this large cohort study of over 1 million children, is 6%. To me, that's a shockingly high figure. 6% may not sound high. It's high, especially considering the volume of confirmed COVID infections that are out there. 6% of children experience a severe enough acute stage of the infection that they are hospitalized. And out of that 6%, 14% of them experience severe hospitalization. They're on ventilators. They have trouble breathing. They have, heart failure and blood clots. And unfortunately, 1% are fatalities. So these really are staggering numbers. And as we go further into this pandemic, we're starting to see a more clear picture of what the larger implications are. The data are telling us the truth. The data are rising above the contentious debate that we've all been living with for the past 2 years, and ultimately are going to settle the question once and for all of what does this really mean long term? What are the implications for this particular virus and its pathology? So with that in mind, we have a panel of experts, and we have physicians on the panel who can answer any medical questions that will come up. And I think this presentation will be informative, and hopefully it'll answer a lot of the questions that you've submitted to me before I have to get to them at the end. So with that, Sergio, who is our first presenter?
Thank you so much, Alderman Hopkins. And before we get into the meat, I would like to introduce the Chicago Public School side of the house. We do have Chuck Swirsky here with us from Intergovernmental Affairs. We have Jamal Chambers also from that team. We have Jamie Tully, who is representing our health information, our director of health information, and oversees our contact tracing team at the Chicago Public Schools. We have Nikki Goodman, who is a contact tracing manager, who's in the weeds every day, getting her hands dirty, making sure that kids are safe. We have Sonia Brown as well, another contact tracing manager. We have Sarah Martinez, who is a face specialist. And we also have Kareem Pender, who is the director of our family and community engagement department. I also want to recognize we have here Alfonso Martel, who is with the Chicago Department of Public Health. And then we also have Dr. Michelle Funk, who is also with the Chicago Department of Public Health, so that hopefully collectively we can provide you with the necessary information so that you can sleep easier at night. Let's just keep it that way. So that said, let's dive into some of the meat of the presentation. We wanted to start off by really talking about some of the schools that sit within the second ward. Here's a quick snapshot. We have Ogden, Rowe, Noble, Columbus, and Lozano. Later on in the presentation, I'm going to go ahead and show you what some of the vaccination rates are for some of the schools that sit in your ward here, Alderman Hopkins, and also for you, the constituents, the schools that are in your neighborhood. I think it's important that we ground ourselves to where am I? What can I do better so that I can service my neighborhood school? My kids go there, my neighbors' kids go there. What do we do? What can we do better collectively as a group to keep our kids safe and our schools safe and keep them open? So, again, thinking about our schools, I want to go over quickly what we're going to be discussing. I wanted us to ground us first, to put yourself in the location of where you reside within the Chicago Public Schools. But we're going to be talking a little bit about an overview of COVID-19 and safety precautions. We have our contact tracing team who's going to be talking about our processes in terms of what we need to do to isolate, quarantine, and quarantine a classroom. We're going to talk a little bit about safety committees and what schools' responsibilities are to have one, and what their responsibility is within a school to promote a safe and supportive environment against COVID-19. We're going to have contact tracing talk about metrics for adaptive pause. What does this mean for students and families? Does my child have to quarantine? And then we're going to talk a little bit about how to help stop the spread. right? I think you mentioned some really interesting numbers there. Alderman Hopkins, 6%, right? 14% severe hospitalizations, 1% fatality. Those are really interesting numbers in that we need to really figure out how do we collectively take on the responsibility of stopping the spread. It's a collaborative effort. You're going to hear words like collaboration. You're going to hear words like collective. You're going to hear words like responsibility. Whose responsibility is it? That said, moving on. Some of the things that we talk, some of the things that we have in schools and how we talk to schools and what principals relay to their communities is universal masking, right? Masks, we know, are very important to help stop the spread. Wash up, back up, mask up, test up, and backs up. The 5 ups that CDPH comes up with, those are the ups that we're just really pushing into schools. HEPA filters in each classroom. Good air is good air. Quality air is very important. Hand sanitizing. Again, another strong feature to help kill the virus. Students eating in classrooms in lieu of cafeterias with some recess and lunch supervision, right? It's very important that we isolate and we keep kids in pods and working together and moving together throughout the building in high pass, high touch areas, keeping them together. So why? So that Jamie and her team can be more effective at identifying where the actual case is coming from. Very important information. We talk about students, we always talk about students in middle school remaining in pods. It's very important. These are the kids that are more active, more out and open, more moving around, but we got to keep them in pods. You got to keep them together. We look at same day exploratory class for 5 weeks, assigning bathrooms to classrooms, very important. Again, common theme, keeping kids together, grouped together. Preventative switches to remote while contact tracing is happening. We need to be able to do our jobs effectively in order to ensure that kids are being quarantined, kids are being isolated from the other population where we know there is an infection happening. Minimizing hallway and locker use. So how are we modifying the traffic flow through a school? These are some precautions that schools are held responsible, they're held accountable to. And after visiting schools, I know these things are happening, and I can attest to this because I was just in a school today. I was at Cameras Elementary, and I saw these things happening. I saw the principal working to rush kids through the line, getting them to their class, pushing them into their classroom. So, it's really important that, I bring that up to the front of the line and say, I saw it today, and I see it when I'm in schools visiting. So that's a very important feature there. I'm going to turn it over to, I believe, Sonia, to talk a little bit about our contact tracing. Again, really big team, really enthusiastic team when we're talking to them. They really take this job serious. I need to say that as well. And couldn't think of a better bunch to do this work for the district. So Sonia, can you go ahead and enlighten us a little bit about contact tracing, what we're doing in the Chicago Public Schools?
For sure. Thank you so much, Sergio. Thank you for having us, Alderman Hopkins. My name is Sonia Brown again. I'm one of the contact tracing COVID-19 response managers for our team. I just want to talk a little bit about contact tracing. So to start off, contact tracing is a mitigation strategy to help slow the spread of COVID-19. So contact tracing occurs when OSHW receives a self-reported case from a student or staff member, or receives a surveillance positive case of a student or staff member. The case is then assigned to a contact tracer for investigation. During this time, principals can flip students who they have identified as close contact to remote learning while our team investigates. This is the most essential public health action. Contact tracers then review the cases, and then they identify if they need to reach out to the family to get more information. Contact tracers also reach out to principals for close contact information, which cohort or classroom was impacted, which teacher may have been impacted, if the case attended any after school or sports activity. We want to get all of those kids and individual or close contacts quarantined. Close contacts are then added to the case and receive quarantine letters based on the last day of contact with the infectious individual. The COVID-19 managers and our CPS tactical team, I'm sorry, somebody just popped up. Our CPS tactical team, we meet daily to look for possible clusters or potential outbreaks in schools. The tactical team then reaches out to the school safety committee immediately if outbreaks, clusters, or large number of cases are discovered in a particular school. Next slide, please. And so we talked a little bit about the safety committee. Sergio, I don't know if you wanted me to go to do this slide or if you wanted to do it.
Yeah, I think absolutely, Sonia. Why don't we go ahead and just transition into what some of the safety committee does at our schools?
For sure, for sure. So our safety committee, so they consist of a team of staff members at a school, and it's inclusive to the principal and also the assistant principal. So the principal and assistant principal can be a part of the safety committee team. The teams ensure that proper mitigations are in place in the school to help slow the spread of COVID-19. The team meets at the direction of the CPS tactical team if they meet specific measures for an adaptive pause. The team votes on whether to pause instruction or in-person instruction or not when the district tactical team identifies that their school meets the threshold.
Thank you, Sonia. And so again, I think it's, again, very important points here in terms of information that we're collecting from the student, from the school, from our testing program, so that we can have the information necessary to provide to schools so they can make the educated decisions on what needs to happen with the classroom, what needs to happen with the group of students, what needs to happen with the school, right? What needs to happen with remote learning. And so that's why, Jamie and the team work diligently to ensure that we have the most robust information prior to making those decisions. Need to really hit that one home with you guys today. I'm actually going to now turn it over to, let's get some diversity in the voice here. Let's go ahead and turn it to one of our other contact tracing managers, Nikki Goodman, to talk to us a little bit about metrics for adaptive pause. Nikki?
Great. Thank you so much, Sergio. And thank you, Alderman Hopkins, for providing this space for us. We're really happy that we can, communicate this to your ward. So there are specific metrics that have to be met for an adaptive pause to happen. And that's where this, safety committee comes in as well. So the school will be eligible to vote to transition to remote learning via an adaptive pause if either one of the two conditions are met and confirmed by OSHW official data. So the first metric is classroom teacher absences due to COVID-19. So either 30% or more of the school's classroom teachers are absent for 2 consecutive days because of the employee's documented positive COVID-19 cases, as confirmed by the Office of Student Health and Wellness Contact Tracing Team, or the employee's OSHW directed quarantine or isolation, and where the school-wide teacher absence rate due to the documented positive COVID-19 cases or OSHW directed quarantine or isolation remains at or above 25% with the use of substitutes or internal staff. So the student metrics that need to be met for student absences, closing metric for individual schools, COVID-19 surge during a COVID surge, which is defined as a high community transmission, which is level 4, which you can find on the CDC. They have different levels of what the transmission is, which is more than 40% of the school's student population has been instructed to isolate or quarantine by OSHW or CDPH. During other periods, defined as low, moderate, or substantial by the CDC, so that's those levels before 4, 1 to 3. More than 50% of the school's student population has been instructed to isolate or quarantine by OSHW or CDPH. So as you can see, the metrics that we have to meet for an adaptive pause are very thoughtful and are very specific as well.
Thank you, Nikki. Do you want to go ahead and take us
Sure.
through what does this mean for my students, my kids, and families, please?
Yes, absolutely. So what does this mean for students and families? If a school does meet the metrics for that adaptive pause, students will learn remotely while in quarantine for 5 days. So note, those remote learning days are still days of normal instruction. So attendance will be taken, grades will be recorded. It'll be like a normal school day. So children will return to in-person learning on a specified date as directed by OSHW or unless otherwise directed by CDPH. We will send communication to all families with that specific date. So, they will receive communication from us. On that first day of remote learning, they will receive a paper packet from their teachers that they should complete at home. And then for the duration of that quarantine, students will receive that direct instruction on their Chromebooks, meaning they'll be logged into Google Classroom from their devices and participating in school that way. During this time, devices are available for you to pick up from your school. They will provide all technology that you'll need for remote learning. Meals are still available for pickup for students during adaptive pause, as well as instructions are available for you to know how to participate in remote learning with your student.
Thank you, Nikki. And so again, I believe this really demonstrates, the opportunities being created so that there isn't instruction being lost, right? As a social service of education, our what we provide, it's very important that we look and manufacture the appropriate processes so that instruction does continue, whether it be in person, which is the gold standard, and pediatricians will tell you this, and Dr. Funk will shake her head, yes, the gold standard of in-person learning, or also in the event of, right, that there isn't a COVID-19 infection, that we do provide the opportunities so that instruction can happen after, that can happen at home. And we're going to be counting that attendance, and we want to make sure kids are still participating. That said, I'm going to go ahead and turn it back over to Sonia for one last
Sergio,
slide.
before you,
Yes.
I
Yes,
was going to hold
please.
my questions to the end, but I'll forget about this one, and it's relevant to the slide we just saw. When
Yes,
you
sir.
you talk about staff absence and teacher absence due to confirmed COVID cases as being one of the metrics. In my mind, a teacher saying, I'm not able to come to work today because I have cold-like symptoms. Oh, and by the way, we're at a level of, 8,000 new cases a day and 20% positivity rate. To me, that's a confirmed COVID case. I think you could safely assume, right? When the numbers are what they are today, maybe not so much. Maybe, maybe there's other reasons why they have that absence. So could you shed a little bit more light on how you go about making sure it is in fact a confirmed COVID case that is the cause of that teacher absence? If we're relying on that as a specific metric, it seems that there's got to be some flexibility in meeting that definition, especially during times of very high transmission.
Yes, and so testing, very important feature of how we're able to identify whether or not somebody is truly a confirmed COVID-19 case, right? Testing is offered. We have surveillance testing being offered within our school system, but also, right, again, you heard me talk a little bit earlier about responsibility. It's a shared responsibility, Alderman Hopkins, for the community as well, that if you feel sick and you feel ill, right, your first reaction should be, I am going to seek a COVID test from my doctor, from an urgent care, from wherever I need to go, so that I can tell for sure that I have the virus, that I can report this to my school, that I can say, don't let me in the building because this is something that is happening with me. So testing, right? Wash up, back up, test up, backs up, and mask up. The 5 ups, you're gonna hear us say that often as well. So that's one of the best mechanisms, Alderman Hopkins, to prevent somebody who has COVID from coming into the building. Contact tracing, folks. Anything else you want to shed light on in terms of the Alderman's question there?
No, I think that's right. The metric does include any COVID impacted individuals, so it would include the staff members who are quarantined by our team as well, if they did come in close contact with a positive case.
So someone, for example, who had contact, now is showing symptoms, does the right thing and calls to say, I'm not coming to work. Oh, and by the way, I can't find a test, which we just had a period of about probably almost 2 weeks, where it was extraordinarily difficult to find a Buy Next Now at Walgreens or CVS. And now supplies have returned, but there was a time when people were not necessarily able to get their hands on a test right now. So, in that situation, again, in my mind, it's good enough, good enough for me to count as a confirmed COVID case, even though you don't have that official confirmation, through a rapid test or even a PCR test.
Yeah, and last comment on this one here, Alderman Hopkins, but I'm reminded of a press conference that that our Commissioner of Public Health, Dr. Arwadi, had just several months ago. If you're sick, stay home, right? If you are ill, stay home. If you have the flu, you don't want to go to work with the flu, stay home. And you're right, it can be suspected that they came in close contact with somebody who had COVID. They're developing the symptoms, they can get worse. There's a likelihood that they may have COVID. There's a likelihood that they may not. That's why testing is the most accurate way. If testing is not available, the next course of action is stay home and take care of yourself, get better, and then revisit coming back into the workplace or into the social life. I think that's the best thing. That's the best thing that we can offer right now. But that's a very good question. Thank you, Alderman. Let's if it's okay, let's go ahead and continue. Absolutely. Okay, great. Thank you. So we're going to turn it over to Sonia just to talk through this last question here. Does my child have to quarantine, Sonia?
Thank you, Sergio. So we get this question a lot from a lot of parents. Does my child have to quarantine? So while all students will be learning remotely, not all children will be required to quarantine. Kids should only quarantine if they are experiencing symptoms and or isolate if they are positive for COVID-19. So if a child becomes positive for COVID-19, a parent should self-report to us at cps.edu/COVID results. If they are unvaccinated and have been identified as a close contact of someone who has tested positive for COVID-19, they should also quarantine. Kids who are fully vaccinated, students who are fully vaccinated, even if they are close contact, if they're not experiencing any symptoms, they do not need to quarantine.
Okay, so I think that's a really good point there, that last point you made there, that if the student is fully vaccinated, they have a booster, because some of our kids can qualify for a booster now, right? And they come in close contact with somebody from COVID-19. Sonia, you're telling us that they do not have to quarantine. Fair statement?
If they are not experiencing any symptoms.
If they're not experiencing any symptoms.
Yeah.
Okay, so that is the high point there. If they're not experiencing any symptoms, they don't have to quarantine if they're fully vaccinated.
Yes.
Lovely. Okay, thank you so much. So I think that can definitely take us that gives us a good segue into our next part of this presentation in terms of what is the responsibility that we have to help stop the spread. It's a collective effort, okay? And Alderman, I did want to just present here some of the schools that sit and reside within your ward. We went ahead here and added the school type, CPS versus charter. We added the numbers of students that are enrolled, and we also added the percentage of students that are fully vaccinated. I need to take note, and need you to take note, folks, on this meeting here, that a person is considered fully vaccinated 2 weeks after completion of a 2-dose mRNA series or 1 dose of Janssen vaccine, mRNA, Pfizer, and Moderna. Fully vaccinated is what we're seeking. Not one. This here clearly says a 2-dose series. Boosted, even if that is the opportunity. I have an appointment for one of our regional clinics for my 12-year-old who attends Kenwood. We're going to be taking her to Richard so she can get her booster. Very important for us. Myself, my wife's a nurse. It's very important that we have that, because my wife is already risking, right, going into the hospital, working on the COVID floor. That's what we're calling it. So we need to protect our kids, protect ourselves. That is our responsibility that we're providing to the Chicago public school community. But again, as you can see, some of this data here does reflect that we have some work to do, right? Lincoln Park High School, looking very, very good on the side of getting their high schoolers vaccinated. Then we have Rowe, right? It's a charter school. There's a little bit of a lag between charter school and the data that we're getting from them in terms of vaccines, but in anywhere you see less than 80% of a student population vaccinated, there's a lot of work to do there. And it starts with education. It starts with bringing the information to our parents. Why? So they can make educated choices on the right care, on what is the right care, on what is the right time, and what is the right place to pursue, in this case, the COVID-19 vaccine. So wanted to share that with everybody here, Alderman. Next, we have here, just in terms of helping stop the spread, we have, through the Chicago Department of Public Health, represented here by Dr. Funk, we have Wilbur Wright College. They have vaccine events there for people to take advantage of. They're there. Opportunities exist. It's whether or not we decide to take the action that's going to bring us into the shared responsibility of helping mitigate the spread of COVID. Here are 4 other opportunities that reside in Network 6, which some of it falls in your ward, Alderman. Your ward doesn't necessarily fit geographically over the Chicago Public Schools, but here are some more opportunities that are available in our Chicago Public Schools. These are 4 schools where we have a mobile provider coming in, providing the first and the second dose. You'll see Healy, for example, February 8th and March 1st. You see that it's roughly a month apart. First dose for the February 8th, we're asking 3 to 4 weeks after that first dose, we want the second dose to happen. So we program another day so that Healy staff can get their second dose, or I'm sorry, Healy students and anybody around the community can get their second dose there as well. 1 and 2, you heard me say it earlier, a 2-dose series. Very important to be fully vaccinated. And then you also see the other schools that we have here, Lozano, Drummond, and Chicago World Language Academy. We have more. Our colleague Ken Papina, Director of Health Services, not on this call, stood up about 56 events, stood up the 56 events in one day. So they're happening. Now it's just time to take advantage. I also want to point out here, people on the call today, call the Healthy CPS hotline. We have an informational hotline. We have a hotline that can direct your call to one of our coordinators to help you register for a vaccine. That's a very important feature, right? Sometimes people just need the push, that extra push to say, I can use some help. We want to provide that help as a district. Also, Alderman Hopkins, there are people and families within your communities that fall within a low income level, right? They fall within the Medicaid population. If they have Medicaid, they can definitely seek this vaccine through their Medicaid health plan. We can help them seek that as well through our hotline. I think the biggest piece that I want to point out here is that there are benefits and a comprehensive level of services available to your constituents, to our families at the Chicago Public Schools. But what we need help with is getting the word out, getting people comfortable with taking action. And taking action in this case is making a phone, is just one phone call away. Is just one email to the principal connecting them to us. Another opportunity here to get vaccinated, you have vaccines.gov, put in your zip code, it's going to show you the world and the universe of vaccines that exist around you. Send a text to the number listed here, 438-829, and you'll get a location for a vaccine. If you need somebody to come to your house and vaccinate you, the Chicago Department of Public Health, through this helpline, you can schedule an appointment and they can go to your home to vaccinate you. So it's not that the opportunity is not there. It's just whether or not we're deciding to take action. And if you need more information on if you need to take action or not, call our hotline. We can provide you with resources so that you can study and you can understand and comprehend and make the appropriate decision for you and your family. Last piece that I want to highlight here in terms of helping stop the spread, and this actually this kind of piggybacks off your question earlier, Alderman Hopkins, about I'm sick, what do I do, right? In this case, this is opt-in testing for the Chicago Public Schools. We're providing a surveillance testing program. We are looking at certain groups of kids throughout the school day, throughout the week, and testing to see what is the impact of COVID within a building. That provides our contact tracing team with the most up-to-date information on a school so they can consume the data, help schools understand the data, and help schools make the decision based off the data. Very important feature here. Any CPS parents, if you have not opted your student into this testing program, I highly encourage you to do so. I myself have both of my daughters opted into this program. My daughters got tested 4 times already in the past 2 months, and I can say for sure that they do not have COVID-19. One of my daughters was quarantined from her class because of a small spread in her class. She was tested negative. These things do work, but it's up to you and up to us so you have the information necessary to make the decision on how to opt in for testing, which you can see here. If you have any questions on how to do that, again, our hotline is available, 773-553-KIDS. That said, that's contact tracing. That's the metrics for adaptive pausing. This is a little bit of helping stop the spread and the shared responsibility that we have as a community and as a city. I am going to now turn it over to Alderman Hopkins for some of the questions that I know that you have, that you've received, and will help facilitate. And we have our contact tracing team here as well to start this discussion. Thank you, Alderman.
Okay, well, I'll keep with the theme and I'll raise my hand to ask my questions. We actually have some very good questions in the chat, so thank you. I've got a number that were pre-submitted. The clock is ticking. I want to try to get to as many of them as I possibly can. But I'm going to take aldermanic prerogative. I'm going to start with one of my own that occurred to me again during this presentation. When you were talking about the HEPA filters in every classroom, I am a big believer in HEPA filters and have been pretty much since day one of this pandemic. I'm a disciple of Lindsay Marr. Some of you might know who that is. But what we're facing right now, of course, is Delta was much more transmissible as an airborne pathogen than the wild type virus was. Omicron, much more transmissible than Delta. Now we're looking at a new subvariant, B2, that is even more transmissible through the air than Omicron. So HEPA filters are wonderful. I love them. They may not be enough anymore. We may have to up our air treatment game as a result of what we're seeing. And just to give you a real world example, you've got a HEPA filter in your classroom and it's in the back of the classroom. And now it's circle time and the children for a story, they gather in a circle on the floor on the opposite side of the room from where the HEPA filter is. If one of those children happens to be asymptomatic and infected with Omicron, God forbid the BA2 variant, transmission is likely in that scenario, right? And the HEPA filter can't help because it isn't properly placed. And that's just one more example of how we need a little bit more of an engineering emphasis on individual classrooms. HEPA filter placement, ventilation, airflow direction, fresh air turnover, carbon dioxide monitors, all of those things are very important tools, but how you put those tools together is very important as well. So I guess that's my rant for the day. I'm just hoping someone can respond and let me know what CPS is doing from an engineering standpoint to monitor the air quality in classrooms and try to minimize transmission of this airborne virus through those technologies.
Okay, so unfortunately, we don't have anybody from our facilities department there right here who can help address some of what we do in terms of air quality, but I know that that is something that we do take very seriously at the district. And for future instances, I think I'm going to take note of this to make sure that we have the appropriate staff on here to be able to address something like that, Alderman. I do also want to just highlight that, all classrooms are not the same. All schools are not built the same. And which is why we have safety measures and protocols. And the one that I'm thinking right off the top of my head is masking up, right? In any situation that you go to, if you take your family to the movie theater, or if you take your family to the grocery store, one of the key features of you being safe in any situation that you're going to be in is having that mask, that KN95 mask, which is something that we provided to all students at the Chicago Public Schools and any citywide staff that work for the Chicago Public Schools. So that's one of the areas, right, where if there is poor air ventilation or air quality, which is one of the areas that we want to make sure is happening, that people are continuing to abide by, keep your mask on. Don't keep it here under your lip or above your lip. It has to be worn the way it's supposed to be fully operational, fully functional. So that's how I can help address some of that part. Chuck, yes, please.
Yeah, I just want to add also, hi everyone. We also spent from our ESSER funds $100 million on air quality. That includes some HVAC replacements. We have air monitors in every school to test the air quality in all the classrooms. So they do that every day. Those are a couple other things. And we also have invested in masks now for students and teachers.
Very good. Yeah, and I'm sorry to throw a curveball because I know we didn't have anyone from the facilities on the call who would have been able to answer that question. But when I saw the HEPA filters mentioned, that just occurred to me because I really believe we have more work to do, but I'm encouraged, very encouraged by the commitment to have HEPA filters in every classroom. That's an excellent start. So thank you.
Absolutely.
So here's a very good question in the chat, going back to the metrics for an adaptive pause. Obviously, during times of high transmission, contact tracers get overworked. They get behind like everyone else. So what is the danger that too much time will lapse before you are able to document and confirm cases? And the questioner points out that by the time cases might be confirmed, the 5-day quarantine period will have lapsed anyway. So how are you dealing with the the demands created by the sheer volume of trying to confirm all those cases in order to properly authorize an adaptive pause?
Sure, I can answer that question. So we do a few things as a contact tracing team when we are in a surge. We do prioritize cases depending on the number of cases at schools, and we work really closely with the Department of Public Health to help us identify the types of cases that we should be prioritizing. In the vein of the adaptive pause question, we as a tactical team at the district level meet daily, and we review a lot of different metrics to help us identify where we may be seeing schools that are having problems to prioritize for our contact tracers so that we can address them more quickly in that timeline. We also work really closely with principals to empower them to take quick school action at their school. So they submit all that information to us as well. And that is another way that we monitor all of that to support the work.
Okay, thank you, Jamie. Another question from the chat. Has CPS filed your remote learning plan with the Illinois State Board of Ed?
Chuck, I don't know if you know the answer to
Yeah,
that
Chuck,
question. We
that's, I
may need
think-
to come back.
Yeah, that may be a follow-up
Alderman,
there.
Yeah, I'll have to follow up with that question.
Okay, yeah, it's news to me that you were supposed to do that too, but someone in the questionnaire box seems to think you're required to do that.
A remote learning plan was the question?
Yeah, your remote learning plan apparently has to be filed with the Illinois State Board of Education.
Okay.
Okay, and who do you see as your target audience for your COVID dashboard? Who is waiting at home to read it? And do you feel that you're speaking to them, that you're properly serving that audience with the data and information you provide?
Sure. So the data that we report as a district has shifted throughout the pandemic, as have many things throughout the pandemic. So we continue to learn and receive feedback from the public about that data. We do want that to be as useful as possible to families in the district, and that is what we're driving towards with the data we're reporting. I do know you had some questions, Alderman Hopkins, about the data, and we are continuing to take that feedback and assess how we can balance reporting what families need to know with protecting people's privacy at the school level.
Yeah,
Okay.
and just to piggyback off that, we want to make sure that we're publishing high quality data for families that is accurate and that is timely, so that again, help them make decisions, right? Again, this is a collective effort. We do appreciate feedback. And one of the things that we do work on though is making sure that we are, again, publishing it in the most accurate way and that families have access to it.
Okay, and CPS has officially on the record, you have acknowledged that the timing wasn't very good, behind the decision to stop reporting open cases at the school level at the time you did it without an explanation. It caused a lot of suspicion, caused some anger. You guys have dealt with that. Think you've even apologized for it. So it's not my intention now to keep pushing you into that corner. But we did have a pointed question, and I'm going to ask it. There are those who suggest that was intentional. So I'm going to give you guys the floor to directly respond to that head on, and I'm sure you do have an answer for that.
Yes, it was not intentional. I think there's a lot of nuance to this data. At the district level, we get data from both of our surveillance program internally with CPS, as well as a lot of self-reported data. And that self-reported data is not always the cleanest to come in. We do a lot of work to identify duplicates. Sometimes we receive reports of cases that end up not being cases at all. We have people reporting even though we've received their tests through the surveillance program. So it's a lot of validating the data to make sure that what we're reporting is the most accurate. So we're assessing all of that internally, and there should be an announcement soon with how we're shifting that data
Okay.
and how it's
So-
represented.
So your assessment is ongoing, it's fair to say. And certainly some of that is in response to, the complaints that you got from a lot of parents. And, there was a lot of stuff going on social media. I know you saw that. And so basically the takeaway from this is you're responding to this, you're making adjustments, corrections, and you will have an announcement about the specifics of that at some point.
Yes.
Okay.
Correct.
All right, thank you. And along these same lines, yesterday was the final day that hospitals would be required to directly report COVID deaths to HHS at the federal level. It was a reporting channel that was created in response to this pandemic. And it, in my opinion, has been one of the more reliable metrics and one of the clear indicators that we can use to sort of glean where we're at in terms of the risk level in a given community. And for reasons that I still don't fully fathom, HHS has asked hospitals to stop doing that. So I was wondering if anyone from the Department of Public Health on the call, maybe Alfonso Martel might be able to respond to that, or possibly Dr. Funk, if you could opine on that situation, because I just think it was a regrettable mistake, and it's going to, cause one formerly reliable source of data to potentially no longer be available to people.
Hi, this is Michelle Funk from the Chicago Department of Public Health. I'm the medical director in the youth settings group. So just kind of to give some context, as at-home tests have become more and more popular, public health professionals have been trying to rely on different ways to determine the impact of COVID-19. And of course, at-home tests are rarely reported. So we do take into consideration factors like hospitalization, which are becoming more important. But one of the ways that this data gets clouded is that many hospitals do perform screening tests on all or nearly all of the patients as they enter the hospital. And so it can be challenging then to parse out which of these individuals who are hospitalized because of COVID-19, or if they're hospitalized because they have a concurrent illness that just is separate from COVID-19. And one of the other things that can be really difficult to distinguish is that sometimes people who have certain comorbidities can be more susceptible to COVID infection, and that COVID infection can sometimes worsen those comorbidities. And our current traditional ways of reporting can make it really challenging. And in many cases, it's not always a clear-cut answer in terms of which of those issues was the predominant problem. And so that's, I believe, where some of the controversy lies at this time.
Okay, yeah, thank you, doctor. And it's a very good explanation of why it's not perfect. And it's clearly not. I guess I just, I'm of the opinion that it was good enough. One of the things I think we enjoyed from that was the immediacy of it, because hospitals directly reporting, many of them on a daily basis. I guess now we're going to rely on coroners and medical examiners, kind of filtering that to come up with a cause of death. I think it's a mistake, and I'm sorry that it's happening. I know nobody on this call had anything to do with that decision that came at the federal level, but it's just one more indication of the challenges that we're facing here, trying to come up with some consistency, some universal standards for how we report COVID data. We've got all sorts of different COVID dashboards all over the place, some better than others, and nothing is standardized. And it creates a very cloudy picture, especially for laypersons. That's what we want to know. We want a single source where we can go to and in clear, unambiguous language, kind of get a snapshot of how bad things are on any given day. And that data that was being provided on hospitalizations and deaths, as imperfect as it may have been due to, defining it, it was better than nothing. And I think that's unfortunate that decision was made. I hope it'll be reversed. So, but thank you, doctor. That was a good explanation for the rationale behind it. Um, Let's see, someone wanted to talk a little bit about data privacy. You mentioned that we have to be cognizant of, revealing specific cases in a manner that it can then identify the student. And so we've taken steps to provide a reasonable amount of privacy there. How are you reconciling that with the need for, parents at any given time to know when there has been a potential exposure?
So, sorry, was the question is, how do parents know when there wasn't a potential exposure at the school?
Right.
How are we,
So,
how are we
right,
keeping,
relying on data privacy to, the conflict between honoring data privacy and failing to inform when there's been a possible exposure.
Sure. So when there is a potential exposure at the school level, so a child is identified as a close contact per the CDPH and CDC guidance, those close contacts are notified by either the principal or our office. There is also a community letter that goes out from the principal to the school community that identifies that there was a case in the school, but we really talk about that at a much more global level, so that we're not identifying the person and violating their privacy rights.
yeah, and if I can add to Jamie that, we as a district have a both legal and ethical obligation to protect the medical privacy and health information of our students. It is imperative, that only administrators within buildings know, right, who has tested positive. I mean, we've had issues and reports of students and staff being harassed or bullied for having COVID, being accused of transmitting transmitting the virus to other classmates. That's a very serious situation. Let alone we have bullying has been a situation that has been an ongoing thing where, we as a district really work hard to create safe and supportive environments for all students and all staff to thrive, right? And so it's important, again, that only administrators know this information. Teachers, fellow students, and other families are not notified of who is positive versus who is quarantined. And this is, again, to just highlight what Jamie said, to protect the privacy and the health information of our entire CPS community. Now, I shared with you guys the status of my children's vaccination earlier. That was my decision, my choice to share my experience. That's different. And so that's why, again, very serious matter. Alderman Hopkins, thank you for bringing that to the front of the line as well. And just so you know, we continue to, as we become the architects of new data systems, that is one of the first things that we always look at.
Yeah, and we've all seen the news reports in recent days with the decision from the Sangamon County judge. There's been a significant increase in reports of bullying among students when now you have half of a classroom wearing a mask and half not. It's a recipe for conflict, and it's happening. So that it was a very unfortunate decision, in my opinion, by that judge. And personally, I hope it gets overturned. Someone wanted you to comment on a test to stay program and how that could potentially fit into CPS's protocol.
I'm going to let Jamie take this one as well. Jamie?
Sure. So we have done a small pilot for the test to stay program and are looking internally to identify an opportunity to scale that program. So we're continuing to figure out how we can bring that to scale given the size of our system.
Okay, would Project Shield be involved in that? Is that one of the vendors that you would be using?
I don't think at this time, but we'd have to assess that.
We have been working with the state on additional testing. I don't know if Shield's part of that yet or not.
Okay. Another question going back to the HEPA filters, and again, I know we don't have anyone from facilities on the call, but the questioner is suggesting that this particular model that was purchased, the IntelliPure, is considered one of the least efficient. So, was there any sort of analysis done based on, say, the square footage of an average classroom, or how the filter might interact with the students. Obviously, the noise of the fan motor is a factor to consider in the classroom environment. How was the purchase decision made for this particular model of HEPA filter?
Again, that is part of our facilities, and operations team. And, again, just clearly, these are all learning experiences in terms of what we're doing here even today. So we can definitely take that one back with us, Alderman Hopkins, and shed some light on that. Chuck, if you'd like to add anything there.
Yeah, I'll just say depending on the size of the classroom, if there's a very large classroom, I've been in classrooms where there's multiple HEPA filters in it. So I can't talk about the quality like the question asked, but I can say based on the size of the room, if it's a large room, there's multiple HEPA filters in there. So
yeah, that's good. I think generally more smaller units is preferable to one larger unit, both in terms of potential fan noise and then also just having different point sources around the room that have a greater ability to capture the airborne virus if it's flowing on an air current throughout the room. So all right, someone would like to know if you are looking into opening more VAX sites in more different schools. I know there was a screen earlier that showed some of the upcoming ones, but is there any plan to expand the number of schools that will have on-site vaccination sites?
Yeah, so we definitely are looking at expanding vaccine opportunities. And as we speak, our colleague, Director of Health Services, Ken Pepino, is diligently working to multiply the number of vaccine opportunities located within our buildings. We started off at a smaller scale, but like I mentioned earlier, we're up to 56, 60, depending on the week. We do have a force that is out in schools. We have 4 regional standalone clinics as well. There's been conversation about opening up more of those. Those are doing very well. But one of the things that I need to shed light on here, Alderman Hopkins, is that schools are not going to solve the vaccine problem, but instead, what are we doing with the community-based health centers and other opportunities that, for example, Chicago Department of Public Health is providing? We do have some partnerships with, for example, UI Health, Cook County Health, Esperanza Health Centers, and Access Health Centers. We're partnering with 63 community-based health centers so that we can stand up some vaccine opportunities for CPS families within those centers, not just during the school day, but again, on a weekend or during the evening. One of the things that we are talking about, and that the health services side of the Office of Student Health and Wellness really takes to heart, is making sure families have the information necessary to seek the right care at the right place at the right time. And so, yes, CPS does value those opportunities that are being stood up within our buildings. But again, this is a collective effort. This is a shared responsibility. This is, where do I go myself to get my child vaccinated? What's most convenient for me? Because it might not be 8 a.m. at my kid's school because I have to go to work. It might be a Saturday. So how do I get them to their primary care physician? Which is why I want to just share this last piece here. 773-553 kids. That is our hotline. That is, if you need a vaccine opportunity, if you need to talk about testing, if you need to learn something about anything COVID-19, we can definitely help with that. That is for our CPS community, families and parents and students and staff to call and ask questions, right? Leave no stone unturned is the way that we live by, right? To get the information necessary. So the answer is yes, we are exploring opportunities for more vaccine locations and events. Both internally and externally with our partners, which is a big, which that would really shake up how we're going to be getting everybody vaccinated. So that 80% threshold for your schools in the second ward there.
All right, I'm just going to throw out one last question that just popped up in the
Absolutely.
bottom of the chat column, because we set aside an hour and we're at the hour mark right now.
Absolutely.
But this has been very good and informative. Someone is asking again on the topic of test to stay, if CPS would accept a professionally administered test in a clinical environment, assuming it's negative, to allow someone to avoid quarantine when they've had a documented close contact, either in the classroom or in the household.
Jamie?
Yeah, so I believe that would be considered test to return, and I'm gonna ask Dr. Funk to kind of speak to the guidelines around the two programs and kind of the difference.
Yes, definitely. So a couple of things about test to stay, just so everyone has the awareness of what really is involved with the program. Essentially, the student would need to get tested twice within a 7-day period, with the second test occurring between days 5 and 7. And the ideal situation is that these tests are rapid, and by rapid, I mean antigen tests, as opposed to PCR. And the reason for that is because schools need to know right away whether that student can stay. For that reason, the IDPH guidance actually says, and this is often what we align with, and we do in this case, that testing should be performed on site and ideally at the beginning of the school day, because then it allows for the schools to rapidly make a decision about whether a student is potentially infectious and can spread that to the rest of the school. One of the other major considerations for test to stay is that if we have a student who is from a lower resourced community, they may not have the easily accessible testing, just because maybe they don't have transportation to a testing site or other things like that. And so with the goal of test to stay being kind of reducing health and educational inequities, it would minimize that benefit if we kind of tried to focus on this.
Thank you, Dr. Funk.
Okay, concluding remarks. Sergio, take us home.
Yeah, again, thank you, everybody, and Alderman Hopkins for helping us put this together. Again, we feel that this is a very valuable asset in being able to be in front of constituents and parents of the Chicago Public Schools to help bring clarification to any doubts that they may have in terms of, is CPS keeping kids and students safely and well? Are the environments those conducive to learn? And the answer, I believe, is yes, in terms of what we've learned here today. And the feedback that you're providing through the chat, through the questions, those questions that you had for us as well, Alderman, we take those very seriously, and we're going to look into those as we continue to manufacture, again, the processes of COVID-19 for the Chicago Public Schools, the 3 buckets of work: contact tracing, testing, and vaccine. And I want to just leave you with 5 more pieces here. Don't forget to mask up, vax up, test up, wash up, and back up. The 5 ups, very important for us to keep that at heart to help mitigate the spread of this virus. So thank you again. 553 kids, call us with any questions. Alderman Hopkins, thank you.
Yeah, thanks, panel. Excellent job, everyone. Appreciate it, Sergio and Chuck, for helping me put this together, and also for your commitment to answer the hard questions. You know, there's a lot of disagreement, a lot of controversy about many different topics, and we're all stressed out. Everybody is. You know, we've all been experiencing this together for the last 2 years. So after you complete your evaluation of the question of open cases and closed cases and how you delineate the two and how and when you report them, please get back to me after you've completed that work, so I can then follow up with the people in my ward that have kind of been following that issue as it develops. So thank you, everyone, again, for your candor and for your willingness to do this. Really appreciate it. Have a good night, everyone.
Thank you, team. Bye-bye. Good night.
Thanks. Good night.
Thanks, everyone.